Hello, I'm Heather, and welcome to Prudent Media's Health Mantra, where we bring you insightful discussions with leading medical experts. My guest today is Dr. Omkar Churi, a consultant neurosurgeon at Manipal Hospitals, Goa. Armed with over 14 years of experience in neurosurgery and an impressive academic background, Dr. Churi is undoubtedly one of the best and foremost authorities in the field. Welcome, Dr. Churi, and thank you so much for joining us today.
Pleasure. Thank you.
Doctor, can you tell us a little bit about yourself?
I'm a neurosurgeon. Neurosurgery primarily would mean that I deal with surgical problems which are associated with brain, spine, and the nerves which travel all the way to our hands and toes, as you can say. My training has been in Sion Hospital, that is my undergraduation, and then I did a bit of work at other hospitals in Mumbai and had my training at Hinduja Hospital, following which I worked there for a couple of years as an associate, and then I did my fellowships, which included about half an year in Japan and then another 2.5 to 3 years in UK. But Goa is my native place.
Okay.
So although I am born in Bombay, we had already made plans to come back. And whatever I have gathered, the knowledge, probably try and help. Because when I used to study elsewhere, I see people had to travel to these places.
True.
Because Mumbai and Bangalore being
because we didn't have facilities in Goa.
Correct. So whatever I have learned now for the past few years, I am trying to see whether I can utilize it for people in Goa.
That's very commendable, Doctor. Tell us, what does neurosurgery encompass?
It encompasses, as I said, everything that has to do with a surgical problem of the brain, spine and nerves, what we call them as peripheral nerves. Some part of it, of course, when we say brain doctors, it includes neurosurgeons, neurologists and psychiatrists. But the kind of problems we treat, sometimes of course they overlap. It's just like when we have cardiologists and cardiac surgeons. A part of the problem will certainly overlap. But let's say a patient has some head injury or a spinal injury, or there are tumors, or there is a clot in the brain. Then of course the decision about what to do, or there are tumors in the spine or spondylotic problems. These are the things that I generally deal with. Currently, of course, there are newer avenues where we are further trying to solve some functional problems of the brain, but maybe we can have that discussion later on.
Doctor, it's evident that your training has equipped you with a diverse set of skills. Can you elaborate on the different areas within neurosurgery that you specialize in and the kind of cases that you handle here at Manipal, Goa?
Certainly, yes. See, when I was studying in Bombay, or when I was working in Bombay, the part of neurosurgery also has its own sub-branches. Most common being trauma, of course, deals with accidents and whatever happens. Other is vascular problems, that is when people get stroke or when they have a bleed in the brain. Sometimes on the blood vessels of the brain, we get these small balloons because of blood pressure and other problems, and they rupture. So we have to manage those. There are other problems which include spinal issues. Some problem includes pain in the spine or even in the face. Other problems being epilepsy.
Okay.
Pediatric as such is a different and specialized branch of neurosurgery, as it is with any other branches of surgery.
True.
I am personally trained in vascular surgery that deals with the blood vessel problems, and I am specializing in spine and pediatric epilepsy. So these are the cases, these are the branches of neurosurgery that I have done fellowships in, where I have trained in Hinduja and other centers. Most of these avenues of neurosurgery, I have seen cases, I have dealt with them, and probably I have done a few, so as to say. And the difference that I felt, Goan population lives to an average age of 85-90 is what I have realized in the past few years, which was not there when I was training in cities.
Okay.
Probably because of our lifestyle. Everyone is so relaxed, and probably that's why they live longer. But when they live longer, the problems also are comparable. Uh, our diet is good. We eat a lot of calcium. We have a good sun, so the bones are strong. But as age catches up, I see many patients who have spondylotic issues. That is the first thing I have realized, that there are many people above the age of 60. So
Okay.
automatically, the spine problems are more. The second thing is our tourism industry, because many people come here, and we see that accidents are part of the enjoyment, and that's why when we are treating patients also, the load of trauma as compared to the size of our population is certainly more as compared to other places. Other thing which I have realized is, just like people who are elderly will have some cardiac issues also.
Okay.
Similarly, these people, when they have minor falls or they are walking and they bang their head to the door, there is a specific entity which happens, which occurs in elderly population only, and that is what we call as chronic subdural hematoma. Even a tiny injury will not cause even a visit to the hospital. It's that trivial. But over the period of next 2 to 3 months, probably
That's
they will develop a
bleeding.
collection, and that warrants intervention sometimes. These are the three major things. Of course, uh, the kind of cases that I expected to do in Goa, we have done a few other types also. But I feel if we see the difference, probably these are the three things that I have seen more in Goa, certainly.
Doctor, you said that you specialize in pediatric. So I happen to have read somewhere, I think it was some years ago, that you operated on a 9-month-old. A few years I also read that you operated on a 95-year-old.
Yes.
Are there any complications as such involved in, it's such a diverse set.
It is. It is.
It's a diverse,
Yes.
so are there any complications as such involved?
Definitely there are. I mean, when we talk of pediatric, it is often said that kids are not young people. Kids are kids. So their physiology, in the sense the way they respond to medications or they will respond to certain injury, will obviously be different than how adults would behave. And then, since I have worked in a place like Japan where there are so many people above the age of 100 also,
Okay.
old age is your second childhood.
True.
Because like children, they are also very fragile. So the way we handle young population, of course, right from how we evaluate them, kids won't understand when we ask them to lift their hand. They are playful people. So even right from how you take the history about what is troubling them, to how we examine, to how ask a child to lie down for a scan, or an elderly who is so scared to come to the hospital because they are in their hearts aware of what is happening, to convince them, everything starts from there. The child we operated was, of course, a trauma, and as I said, it was a tourist family again, and they started from an airport. The child had a simple fall from 2 feet height at the airport, and they had a layover.
Okay.
And at the layover, the child started crying, and in the next journey, when they landed in Goa, the child was almost unconscious.
Oh.
The child had a big clot in the head, but fortunately, it is brain. The difference between brain and other organs is probably brain does not give us much time when it comes to trauma. Anywhere in the body we get hit, there is a lot of space for the swelling or the bleeding to happen. The swelling comes outside.
Yes.
Now, brain is surrounded by bone.
True.
So that complicates the matter, and that's why correct diagnosis, correct investigations, and then correct treatment becomes essential. And that's why this slogan was there, which was primarily for stroke, but it can be applied to most of the acute problems of the brain, that time is brain. So we can save people only if they are treated in time.
Doctor, this is one case that you've spoken about. Are there any other memorable cases like this that you have successfully treated?
There are. I mean, most of the cases, as I said, we deal with tumors, and we deal with bleeds and strokes and chronic subdural hematomas and spine. But there are few cases which are of course very special to you, especially if you know that you have achieved something surgically or as well as for the patient, which is not so common. So there is one such recent case where uh, uh, I think a 45 to 50-year-old man presented with severe pain in the leg, and he had already been examined and evaluated because he had a huge swelling at the back of a thigh, and there is a the largest nerve in the body, as we call it.
Okay.
It starts from the spine and goes all the way down the leg. It's called sciatic nerve, and we knew that there is something wrong with the nerve. But when we got a scan done, there were almost 7 to 8 tumors just along one nerve,
Oh,
and the largest being 13 centimeters in size. So let's say that the nerve itself is around 7 to 8 millimeter. If we want to remove the tumor, we have to separate it from the nerve and preserve the function of the nerve. See to it that the patient does not have any weakness or pain after the surgery. We were able to do it. And right now, after almost 6 months, the patient is doing absolutely fine. A few cases which we have tried otherwise, the newer things that are there in neurosurgery, one of them is endoscopy. So one of the patient presented with psychiatric symptoms, and that was because of a bleed in one of the major glands, which is pituitary gland. It sits just under the brain, and there was a bleed in that gland. And post surgery, which we did with endoscope, which is one of the newer things, the patient has been doing really well. So of course there are many such, which includes also trauma cases and other cases, but these are a few recent ones which come to mind.
Doctor, you spoke about subdural hematomas and say pain in the leg, and I mean they were so different, the symptoms. Are there any signs and symptoms that people should be aware of, that I need to go see, say, there could be something wrong with, say, my brain or my spine, or are there any symptoms that present?
It's a good question actually. Any acute problem will definitely present with pain when people have appendix problem or gallbladder problem. Most of the time they present with pain. Now similarly, when you have a bleed in the brain, of course people present with headache, or if they have a prolapsed disc, what we call a slip disc, they will present with a pain in the leg. But sometimes, as when it comes to brain, it also is a functional issue. I mean, if you have a problem in the lung, you will have breathing issues. Similarly, what functions brain does: memory, planning the movement of hands and legs, vision, speech. When a certain kind of growth, let's say, is growing in a certain part of the brain, or a bleeding is in certain part of the brain, it is pressing on certain nerves which start from the brain, then the symptoms will be there accordingly. But anytime a person suddenly develops weakness, or in a span of 2 to 3 weeks, he is gradually growing weak on one side, he has shooting pain, he has some numbness down the leg, or as simple as the most common thing that happens with brain is a seizure, fit yate, akdi. That is one of the commoner presentations which warrant some investigation. Anytime you have any doubts, when people present with headache or vision problem, or there is constant headache and vomiting, or as I said, these issues of speech or motor movements or sensations, then definitely it is worthwhile meeting the neuro specialists. As I said, when people present with these symptoms, there is obviously an overlap. There might be a problem which might be purely neurological.
Okay.
There also might be a problem which is purely neurosurgical. But that we will come to know only after we examine and we investigate.
Doctor, but you said headaches. Now, headaches is a fairly common thing, who doesn't have a headache nowadays?
Certainly, yes.
So, how do you know that it's a more serious problem?
If the headache is continuous, see, all of us have gone through headaches, but sometimes we know why the headache is being caused. You have not had food, you are dehydrated, you have had a very long journey, you are at work and your boss has troubled you a lot, or in our case, patient is just sitting in front of us for the past 1.5 hours, and whichever way I'm trying to convince him is not getting convinced. That's the more obvious causes. But headaches, especially early morning headaches, which are associated with vomiting, are clear-cut signs of raised pressure in the head. So any person who has more frequent early morning headaches, and these are associated with vomiting, certainly any headache associated with vomiting, I would certainly say that you should see at the earliest. There are some other kinds of headaches, only frontal headache, which can happen with vision problem, or which can happen with sinusitis. There are some headaches which are on one side, what we call as migraines. But if the headache is troubling you, and if you have never had this kind of headache ever in your life, as we described, the worst kind of headache, then certainly it is worth getting examined. Not all headaches will need an MRI or a CT scan, but one visit to a neurospecialist would certainly, at least allay those fears from your mind that nothing is wrong.
Do people really come to neurospecialists for things like this, or would they just pop a pill and, do you have people that actually come to you for consultation?
Now they have started coming, I think, but traditionally I have seen that when people are asked also to go and meet a neurospecialist, in that
because there is a fear,
especially when it comes to neurosurgery. I've had many people who have come and told me that, we initially went to a physician because whenever we knew that it's a brain and spine problem, but to go to a neurosurgeon by itself, it inculcates a kind of fear in people.
Yes.
And finally, in any branch of life, unless we have the knowledge about it, the fear is always going to be there. And the only person who can tell you that there is nothing wrong would also be a neurosurgeon.
Would that be one of the challenges that you face in your career? Are there any other challenges that you face, any obstacles that you faced?
Certainly. One is the pattern of our work. Accidents and emergencies don't come invited. They just happen suddenly. So we have to be prepared 24/7. There are cases which we end up operating in the middle of the night.
True.
But that is a personal challenge. On the other side, it is the this attitude of people, and for us to tell them. My most favorite example is tumor. For example, any person who gets diagnosed with brain tumor automatically, and I have said this before also, every time I am in a conference or when I'm talking to people, there is a lot of ignorance and myths about brain tumors. Brain tumor is not a single kind, just like tumors in other parts of the body. It's not, any tumor is not, all tumors are not the same. In brain, I would say, if we divide and then subdivide them, there are almost 100 kinds of tumors. And not all of them are cancers. A few of them are easily operable. Most of them would not cause any deficit also. A few of them will, of course, need radiation and chemotherapy and all those things. But almost 70% time, probably it will not be a cancerous tumor, or it will not be a death toll as it is called. But this is not only a general public, it is also my peers, I would say. My training, let's assume that when I joined medicine, it is probably 2.5 decades now. So whatever knowledge I have about other systems, GI, abdomen or chest or heart, all the techniques of treatment, my knowledge would end there, because then I started learning about brain.
Yes.
The same is applicable to other colleagues of mine, that when they think that brain surgery, the kind of technology we had then, the kind of advances that have happened, all of us will know what kind of mobile phones we had in 2005. Correct. And now in 2024, the kind of changes that have happened, we are almost on the verge of AI and robotics and all those.
VR and yes.
Why will medicine not be a part of this
advancements?
So of course, in neurosurgery also, we have so many technological advances now, but it is also important for us to educate our colleagues, because our general physician would be the first point of contact.
True.
It has also happened to me that people have gone to general physicians and they have been told, no, don't do anything for this. But that is also because maybe our my colleagues are not up to date with the knowledge about this. But we are trying to change it. So let's see.
I think knowledge, awareness, creation of awareness is one of the biggest hurdles in any field.
Absolutely, absolutely.
Doctor, as far as staying healthy goes, we've spoken about tumors, we've spoken about when to seek medical attention. As far as staying healthy goes, how is there anything that we can do to take care of our brain health, to take care of our spine health?
It's a good question. I'll start with spine because that is easier. We have 206 bones in the body. Spine has, if it speaks scientifically, there might be 30 plus bones. But for general population, let's assume there are 25 bones. God has made us in such a way that we are the only animal probably which walks on two legs. So our spine has that additional burden.
True.
And elbow or knee being the most common thing which gets affected. Knee is one joint. Similarly, if there are 25 bones in my spine, between two bones, there will be almost 4 joints. And if you consider disc, maybe 5 joints. And if a few of them start hurting, then it gives a lot of problem. Mostly the problem happens in the neck and lower back. The reason for that is, of course, because we use this parts of our spine more. The way those have been made, the neck is always extended. God made us in such a way that we can look at the stars. Now what I have realized, especially forget the elderly people who have spent their life in cooking or cleaning floors or writing.
It's the phone.
Exactly. Post COVID especially, I have seen so many young people in their 20s now come with lower back and neck issues.
Yes.
And the answer is pretty evident. If I have to look at a mobile, there are various ways I can look at a mobile. But I want to hold it as close to me and I want to flex my neck as much as possible. And I want to do this while driving a car. I want to do it when I am riding a bus. Already the roads are wonderful, though that adds to the pressure.
The pressure.
What people don't realize is, let's say my head is sitting on top of my neck and it is putting a lot of pressure on my neck. When I bend it forward 45 degrees, the pressure on my neck increases 5 times. And that's why how we keep our neck and our lower back becomes important. Treatment, part 1 would be diet, sunshine, early morning sun especially. Those rays are very important to generate vitamin D.
Get all the vitamin D.
And most of the people, I don't know whether they actually wake up to see sunrise and younger population. Second thing is adequate calcium in the diet, which comes through milk and eggs and fish. But that's why these problems are more common I mean, it's not statistically proven, but more common as I see in vegetarians. Other problem being people who have that kind of work, drivers where the position changes, or people who are doing manual work, who have to lift up a lot of things. That puts a lot of strain on the spine. Age and sometimes also gender, because after menopause some hormones change and that causes a decrease in estrogen. That has an effect on bone health.
True.
That's why we will see 80-90-year-olds. Grandfather will be still
fine, yes, standing straight.
Correct.
Yes.
But grandmother would be bent forward. The other reason being, which I always complain, and this is on a much personal level, and this applies to all moms, that they will treat their husband, their kids,
and neglect themselves
and not take care of them. I always tell them, whatever you give your kids, if they are having 2 glasses of milk every day, you also have 2 glasses of milk every day. I'm not saying you eat more, but at least eat as much as your 12-year-old is eating at least. And that will solve most of the problems.
True.
Some exercises always help. We should always be active. Walking is a wonderful exercise. Swimming is a wonderful exercise. There are many nuances to the management of spine issues. Excuse me. About the brain, generally we can treat a certain thing when we know the causes. For example, lung cancer. It is already proven that smoking will cause lung cancer. When it comes to brain, as of now, we still don't know what causes brain cancer. I mean, we know, but it is not proven. Like it is proven that if you eat a lot of certain amount of foods, there is a chance of stomach cancer. If it is genetically, if your parents are diabetic, then you have a higher chance of, there are certain very rare lesions which are genetic in the brain also. But the only correlation now that we are finding out is radiation. But again, that is not entirely statistically proven. Otherwise, how do we take care of a brain? Again, it starts with diet. Any food which is rich in antioxidants, or like nuts, almonds or groundnuts, or fruits with vitamin C, all these are antioxidants. Again, there are lots of myths when people present with stroke or anything, that what should we be eating? Should we have a lot of salt, or should we not eat fatty foods? My personal feeling is brain has more than carbohydrates. Brain is made up of proteins and fats. Brain works because there is a fatty layer around it. So of course fats are important, but there has to be a moderation. The problem with our generation as compared to the previous generation is we don't know when to stop. So if I like something, I will see to it that I finish it. So if I bring a packet of Lay's, then I have to finish that at the same time, although it might be
just
but that is the problem, and the moderation is very important. Second is how you live your lifestyle. Any activity that will improve brain health will include use of the brain and such. When we are looking at and this is not only for neurosurgical problems but overall memory loss in the elderly age, the more we use our brain while we are young, the lesser the chance of it giving us trouble.
So cognitive exercises, is that what you're talking about?
When reading, listening to music, because when we look at mobile reels, the problem is we are sometimes mindlessly doing it, and we don't realize that all we are doing is just scrolling. Reading takes an active effort. We have to read a word which stimulates one part of the brain. It has to go to an area which understands that word, then it goes to an area which understands the meaning, and then we make a memory of it. So many factors come. That's why discussions are more important when it comes to a good conversation than just lectures. What we can learn from a lecture is probably less than what we could learn from a good discussion. Same is with reading, same is with music, because music stimulates a lot of parts. Hobbies are important, sports are important, and exercises. What has been proven, yoga certainly helps. A bit of mindfulness to concentrate on the breathing and all goes a long way.
Doctor, thank you so much for your valuable insights. I think what we need to do is heed his advice, prioritize brain health, and of course, seek expert medical care when needed. Dr. Churi is available Monday to Friday, 9 to 5 p.m. and of course 24 hours in cases of emergencies, yes? So do not hesitate to seek help, do not hesitate to seek medical advice when needed. Thank you, Dr. Churi, for sharing your insights, your expertise. It's been such a pleasure. We have learned so much.
Thank you for having me. Thank you.
Thank you all for joining us. That's all the time we have for today. This is Heather saying bye for now. Until the next one, keep watching Prudent Media.